you so much for attending today. We are very excited to share some of our research with you about a study we led to look at the impact of social distancing during COVID-19 on mental health and substance use outcomes, and examining some of the risk and protective factors in young adult populations in New York. So with that, we'll get started. So we actually are going to be presenting on two kind of separate papers that we're leading based on the data that we collected last year. The first one is looking at the mental health impacts of COVID-19, and the second study is looking at the impact of alcohol use, so the impact of COVID on alcohol use. This study was supported by the State University of New York faculty seed grant. So we're very thankful for the support of SUNY and the seed grant money that we had there. And we're also very appreciative of the many individuals that have kind of supported us in collecting this data and analyzing it and working with us on kind of the full project. So it is hard to believe that we are a year into this. These are kind of the current numbers as they stand as of March 5th. Our total cases of COVID are over 28 million, with the total death count being over 500,000. So certainly this year, we've had a tremendous amount of challenge related to COVID, not only with the physical health impacts of it, but also with the secondary impacts of the disease on the population. With this particular paper, again, we looked at some of the mental health and substance use outcomes, but we know that really there's a lot of different factors that came into play when we were thinking about and speaking about the impact of COVID-19 on the American population. New York in particular was initially designated as a national epicenter of the crisis in March 2020, which again, we all know and lived through to some extent, and are very familiar with the regulations that took place in order to try to contain the disease, right? So these stay-at-home orders, social distancing, all these measures were put into place, again, to slow the spread of the disease. Yet we know that these regulations also had a tremendous amount of impact on other factors as well. So social isolation, loneliness, and other psychological health problems are certainly, expected based on some of the regulations that were put into place. So when we consider kind of these psychosocial impacts of COVID-19, this was a novel disease. It was a situation where a lot of people didn't have any, idea of what to expect or the different types of changes that were to come about. And despite that, though, we do have certain frameworks that we can really utilize to try and understand the disease and the impact of it on larger populations. So this disaster framework has been used to examine kind of the impacts of COVID-19, again, based on some other disasters that have occurred in the past. And some of these disasters, again, were natural disasters, but then also, again, pandemics and other things like that. Based on those frameworks, we do know that determinants of vulnerability really are dependent on a number of factors. Again, with the disaster frameworks that were in effect, we can see that there's, the degree of exposure, the amount of destruction of property, the threat to life, physical injuries, etc. These were all factors that kind of impacted how much an individual or a community is affected by the particular disaster that was that we were discussing. Young adults also happen to be one particular group that is of particular concern. Young adults, in our case, really looking at those from 18 to 35, have certain risk factors that could potentially put them at greater risk for certain psychosocial outcomes. So this includes that they are single, right? So they don't, oftentimes the majority of young adults are single, so may not have social support structures in place. They have lower rates of insurance coverage. And then oftentimes that is coupled with unhealthy coping techniques, including high rates of substance use. As such, kind of looking at this population is critically important at this time. So based on this information, Dr. Opara and I led this study where we deployed a Qualtrics survey, and this was disseminated last summer, so starting in July until about October. So it was really kind of capturing the end of that first wave of COVID. And we sampled individuals that were between the ages of 18 to 35, and those that were residing in New York at the time the stay-at-home orders were issued. We recruited using a convenient sample, so primarily using social media channels, email listservs, Facebook, and Twitter. And we had about 684 participants that did fill out the survey. And all of those participants did receive COVID-19 safety precautions and mental health resources at the end of the survey. The first 270 participants also did receive a $10 gift card for their participation. Some of the measures that we collected, so our main outcome variables included measures of depression, anxiety, and substance use. So for depression, we used the PHQ-9, and to measure anxiety, we used the GAD-7. And some of the independent variables that we were monitoring as well were COVID-related measures, coping during COVID, loneliness, using the UCLA loneliness scale, sleep severity and disturbances, and then demographic variables as well. So this is just kind of a breakdown of our demographic characteristics. The average age of participants of our sample was about 28 years old. The majority of our participants were female, they were white, heterosexual, and they had completed 4 years of college or university. The majority of respondents also had an annual income between $20,000 and $50,000 and $50,000 and $100,000. So that we were seeing the majority of our participants, again, in that range. About half were employed full-time, 84% had access to health insurance, and about a quarter of the participants had a positive COVID diagnosis at the time of survey. So in terms of mental health outcomes, again, what we found was that both with anxiety, depression, and combined scores of anxiety and depression, across the board, we had very high levels with both mild, moderate, and severe forms of the two diseases. With anxiety, 36% had mild anxiety symptoms, about 34% had moderate anxiety, and about 10% demonstrated severe anxiety. With depression, again, equally alarming numbers that we found there. About 29% of the sample had mild depression, 35% had moderate depression, 14% had moderate to severe, and about 1.6% had severe depression. So again, we were seeing numbers and rates of anxiety and depression that were far higher than what we have seen prior, and would really kind of demonstrate the need for additional services and intervention. Less than 10% of our population had ever had a diagnosis of anxiety or depression, so a clinical diagnosis. And also, interestingly enough, only about 20% of our population received any sort of mental health treatment within the past 3 months of being surveyed. Okay, so I think that's also a very interesting point because, again, there was this kind of discordance between what we were seeing in terms of symptoms and who was receiving any sort of support from that. Okay. So this again just shows visually kind of the numbers that we were seeing in comparison to the 2019. So the dark blue is the 2019 National Health Interview Survey results for levels of depression amongst American adults. And then our numbers, again, looking at depression and then also anxiety. And you can see, again, across the board that the numbers and the rates that we were finding, the percentage of adults that were reporting symptoms of anxiety and depression were just alarming in many ways. So we looked at some of the kind of the independent variables and the predictors in terms of what was related to depression, anxiety, and then a combined depression anxiety score. And really we found that all COVID-related and clinically relevant indicators were predictive of increased scores for depression, anxiety, and both depression and anxiety. We saw significant differences by gender, and interestingly enough, in our population, males had higher scores of anxiety and depression, which is different than what we see in the general population. Income, sexuality, education, employment, and insurance, we saw significant differences across these categories. So for example, individuals that had no insurance coverage also had increased reports of depressive symptoms and anxiety as well. Along with that, those with more severe symptoms of COVID had elevated scores of depression, anxiety in both. Those with greater loneliness, those with increased alcohol use, and those with more sleep disturbances also had elevated scores as well. And then finally, those that had poor coping techniques also had increased scores of depression, anxiety, and both depression and anxiety. So based on that, we did some multivariate linear regression analyses as well, and found that kind of across the board that taking into account these different variables, the models accounted for a significant amount of the variance that we saw with depression, anxiety, and depression and anxiety. So I think this is, one snapshot to show really the prevalence of negative mental health outcomes as a result of COVID-19, and considering kind of the change that we saw from 2019 rates and levels to what we saw in 2020, there's certainly something there that we need to look into further. It's really important, again, when we see, these high rates of anxiety and depression, which indicate, right, that there could be some clinical significance to this, that we really need to look at the type of services that are available, how services are being utilized, and how these services are really instrumental when we think about recovery of individuals and communities. So like I mentioned prior, we saw this great discordance between the levels of need and treatment uptake, which again just shows how much more we need in terms of services and further evaluation of young people. And really, I think what's important to consider here is that unlike other disasters, so when we think of these disaster frameworks, oftentimes when there are other types of disasters, whether they're natural or man-made, they tend to bring people together. COVID-19 has really kind of interestingly precluded the social interaction and the support that is oftentimes following other natural disasters due to the social distancing measures. So really considering what we can do kind of as a population, as a health system, as a social system, in order to try and address the challenges that we have with a global pandemic such as this, along with those, not only physical health challenges, but mental health challenges that exist. I think it's also important to keep in mind that we've had and we continue to have a lot of barriers in the US mental health care system. And this really kind of highlighted some of those barriers that existed. prior to COVID, obviously there was limited accessibility based on, telehealth services. We had differential coverage based on insurance. And along with that, there was less of a focus on, recognizing and promoting positive mental health. So with that, I think we have a lot to do, but this certainly gives us some information in terms of the severity of the implications of COVID on mental health. I'm going to hand it over to Dr. Opara.
Okay, go ahead.
Okay, sorry, I'll be quick. So for this next section of our presentation, we're just going to talk a little bit about a paper that's under review from this same data that I'm leading that focuses on alcohol use and specifically the increase of alcohol use during the COVID-19 pandemic. You can go to the next slide. So one of the things that we wanted to focus on just from me and Dr. Malik being substance use and also mental health researchers is that we knew once the pandemic hit, like once it was designated a pandemic and once we were all forced to engage into stay-at-home orders, we knew that there was going to be an increase in poor mental health symptoms and also in substance use. Substance use, for those of us who understand the substance use literature, know that people often use substances and abuse substances as a coping mechanism to deal with underlying mental health issues and so forth. So for example, we looked specifically at alcohol use for this paper because it's important for us to remember that during that time of the stay-at-home orders back in March 2020, liquor stores were actually deemed essential. So out of all the stores, a lot of restaurants and so forth were forced to close down during those weeks, but liquor stores stayed open and did not close and did not have any significant financial ramifications. In fact, alcohol outlets and even online alcohol sales rose by 331%. Just 2 months after the COVID-19 pandemic, and I would imagine they continue to rise. So it was important for us for this study to be able to see and disseminate that information to see what this association is between COVID-19 and alcohol use amongst young adults, because having an increase in alcohol use is never going to be a good thing for our population, but especially a population that's vulnerable and doesn't even really have access to proper mental health and alcohol use treatment facilities. You can go to the next slide. So for the purpose of this study, like I mentioned, we want to look specifically at factors, both risk and protective factors, such as having COVID-19, mental health symptoms, sleep disturbances, and so forth, that actually contribute to increased alcohol use during the COVID-19 pandemic. Now, these variables were chosen just based off of the literature and just based off of what we know are typical triggers to alcohol use and misuse among young adults. So Dr. Malik went over these scales, so I won't go too much into it. But one scale that I do want to highlight is the alcohol craving scale. And this scale, we included that in our survey because it's a scale that's often used to assess cravings and to assess self-control and the ability to have cravings to want to use alcohol, and then the outcome of actually using alcohol or increasing your use or using or drinking a certain number of drinks. It's a scale that's often used in alcohol use disorder research. So we just included that in our survey to kind of see how we could put more attention and more emphasis on the use of this scale for substance use researchers and so forth. You can go to the next slide. So just preliminary results. For this slide, I'll just walk you through what we found in regards to people that actually admitted to having an increased use of alcohol. So how this was measured was we just simply asked participants, did your use of alcohol increase, yes or no? So about 104 admitted that their alcohol use increased. And what we found was interesting is that males, although it's almost even, but males seem to have a higher, reported higher increase in alcohol use than women. And what we know in the literature of alcohol use and disorder literature is that often when there's high levels of stress or a disaster, typically women are more likely to have a higher increase in alcohol use and use alcohol more as a coping mechanism than males. So this could also just be relative of the fact that our survey or population rather wasn't generalized and so forth. And maybe if we had a larger pool, we probably would have seen those results that were consistent with literature. Another thing that was interesting is that those individuals who we surveyed who had reported having a COVID-19 diagnosis, about 47% of them reported that their drinking increased compared to those of them who either refused to report or didn't report or had a negative COVID diagnosis at the time of the survey. 72% of the participants who had an increase in alcohol use reported having suicidal ideations. And this is actually consistent with research to show that there is this association between using alcohol as a way to cope, but then also having these underlying mental health symptoms that could increase this idea of wanting to die or just not wanting to live or not feeling good about yourself. Similarly, we found that 60% of the participants either had moderate or severe anxiety, and this is among those that reported an increase in alcohol use, and about 27% reported having moderate severe depression. Moderate depression, while 12% reported having severe depression. And these are amongst the participants who reported having an increase in their alcohol use. Go to the next slide, thanks. So for our statistical test, we just wanted to do a simple logistic regression just to see the association between predictors on the outcome, which was increased alcohol use. And what we found were that out of all of the predictors, the most significant one was actually having a positive COVID diagnosis. So it was 2.15 times likely odds that you were going to increase your use of alcohol use if you had a COVID-19 diagnosis. And I would I would expect this to be true. It was a shocking finding, but it seems to make sense because you have to remember at the time of the COVID pandemic that occurred last year, we didn't know much about COVID. We still are learning about COVID 1 year later, but during that time, it was a very scary, highly stressful, unknown period. So I could imagine, especially with young adults who fill out the survey who had a COVID diagnosis, they were just highly stressed and they needed a way to cope, and most likely that was probably what exacerbated their alcohol use during that time. The second most interesting finding was,
can you wrap up in the next 3 minutes, because we're out of time and we're going to move to the next speaker. 3 minutes.
Okay, yeah, I'll be done. I'll be quick. Okay. Sorry. So the next thing the next interesting finding we found was that the sleep disturbances. We found that it was 1.37 times more likely for you to increase your use of alcohol use if you had high sleep disturbance scores. And just from the research that we know with alcohol use and so forth, is that when you talk to people about their use of alcohol, oftentimes they use alcohol to sleep. Especially when you were talking with youth and young adults and so forth. So it's interesting that we see the opposite effect, that they were actually having trouble sleeping, and this was associated with an increase in alcohol use. And I'll go to the next slide. The next slide kind of actually go back to this slide. Sorry. And just really quickly, we see the same thing with anxiety and depression as well. Where it's a significant predictor in anxiety, that having high levels of anxiety were more likely to increase your use of alcohol use. Sorry, go.